Good afternoon, I'm Mabel Jong, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C., and we're at day two, the afternoon of day two, and we are pleased to have Jeff Myers in the chair next to me, and he is with Medicaid Health Plans of America. Jeff, it's so great for you to drop by.
Well, thank you for having me today.
Well, now we have a lot of discussion coming about specifically about Medicaid. Tell me what your message is at this conference.
Well, I think two big things, Mabel. The first is the Medicaid program last year had 10.8 million new Medicaid beneficiaries as a direct result of the ACA, both in the expansion population and in the populations that Medicaid already covered. That's a significant growth. Over 70 million Americans are now insured by Medicaid, 1 in 5. Next year it'll be 77 million. The cost of the Medicaid program in 2009 was about $390 billion. This year it'll be $546 billion. Tremendous growth for our nation's underserved. The real issue here is how best we can make a program that serves their needs and starts to slow down the curve. And I represent the Medicaid plans that provide that coordinated, comprehensive, and most importantly, capitated risk care for those beneficiaries.
And how encouraged are you with the innovation that's going on in this area? More plans trying to come up with ways to provide end-to-end service, trying to give more attention to coordinated care, and how successful have those innovations been in your view?
Well, it's tremendously important. When you see the kind of growth that we're seeing, anything that can bend the curve really becomes really important. And the two things that I've seen at this conference and talking to my plans is that innovation is really going to make that curve come down. And the things that they're focusing on is how do they outreach to the beneficiary. Remember, in the Medicaid population, that isn't like commercial insured. And then secondly, how can they get providers to provide better care at lower cost? And that's really looking at value-based purchasing, the ACO model, and other risk-sharing things that get the beneficiary's health first and foremost in the thoughts of the insurers and providers.
Well, that's really the $100,000 question, isn't it? We're trying to achieve better care more efficiently at low cost. So what are some of the solutions or ideas that you're thinking of trying to get implemented and getting innovators to come along with you on that ride?
Sure. So when we look at the program, one of the things that's important to remember is that Medicaid is a lot of different populations. The dual eligible aged population looks a lot different than the pregnant 18-year-old mom. I don't know if you're aware of this, but over half the births in the United States are paid for by the Medicaid program. So our plans are looking at the populations and seeing what are the things they can do to provide better care at lower cost. In the case of pregnant women and children, how can we reduce preterm birth? In Medicaid, it's more likely that you don't go to term. That creates enormous costs for the system and terrible results for the beneficiary. In the aged population, how's a way to get those seniors that still have the ability to live in a home and community-based system and not in institutional care? How can we provide the things that they need to live the life they want to lead? And so in each of these populations, you've seen real innovation. But the key thing that brings them all together is the focus on the beneficiary.
Well, it certainly sounds like you have a lot of great issues that you're working on, a lot of great questions. What are some of the solutions that you've seen come about that is showing some success?
Sure. Let me just talk about first the pregnant women and children. Okay. Our plans have really started looking at how can you identify pregnant women early in the cycle. Unfortunately for the plans, it's often difficult to know when someone's pregnant to start that process to ensure they get good quality care. A lot of focus on member involvement via either their cell phone, direct contact information, or direct outreach with a health provider, looking at are there areas that we can provide that care quicker. So a lot of innovation in that place. In the other extreme, in the intellectually disabled and the developmentally disabled and the aged, how can we provide more care to them in a manner that's structured? You've heard a lot about managed long-term supports and services. What's clear to me is there's a lot of focus on looking at the individual in their home and what are the ways that we can provide that care either in their home or get them part of the community. And so the innovation that I've seen at this Congress and others is really thinking through how we can get that individual service in their homes. You're starting to see more home-based services. You're starting to see a lot of focus on really thinking through, are there other things outside of traditional healthcare that makes their lives better and gets them to live the life they want to lead?
What is the ultimately the end goal for the health plans that you work with?
Sure.
I think we talk about the triple aim over and over again, but more short term, what are some of the goals that you want to achieve?
So I think the big focus is two. Our customers are obviously the state Medicaid agencies. The states are under tremendous financial pressure. So our plans are really looking for what are the ways that we can extract efficiencies out of the marketplace. Are there things they can do to start reducing that overall healthcare cost? That is first and foremost, because the system really is financially struggling right now. Secondly, again, going back to the beneficiary, when we look at HEDIS scores and others, are there ways that we can make sure that folks, on something simple, compliance with medication, are there ways that we can ensure those individuals actually comply with with as written prescriptions from their doctor? So big focus on making sure that they get access to the meds they need and use them appropriately.
Are you partnering with agencies or organizations that specialize in that?
We are. The one thing that has been amazing to me in my year and a half at MHPA is that the plans are now moving into populations they did not used to insure. To do that, they really need the best and brightest, and there are a lot of vendor partners that we've paired with that do everything from direct member engagement via cell phones or other direct digital communication to things that are more esoteric, like financial management and determining, is an individual more appropriately placed in a higher level disability? Are there ways that we can identify certain institutions that have better HEDIS scores? So there's a lot of great work from our vendor partners, and that's what I've been most gratified with, looking at how our plans, some as big as United and Anthem, some as small as the Group Cooperative of Wisconsin that has about 40,000. So big and small, all looking for that little edge to make the members get well.
Now, if the plans have always tried to stretch that dollar as far as it could go, how do you pay for some of these partnerships, or how is that working out with the financial arrangements to work with these partners to help you come up with solutions?
Well, that's a great question, and the thing that has impressed me about the partners is their focus on return on investment. Almost every time a partner meets with our members, the vendor lays out how they can provide better care at less cost. And then the issue is, does it work that way in the real world? And as we look at some of the ROI calculations, going from maybe a pilot program and then rolling it into the general population, we've seen real savings, both on the drug side, on the therapy side, on the health side, and even as simple as, again, supports and services.
Okay. Well, Jeff, is there any other message you think we should absolutely have with us for our attendees?
Sure. I would say that Medicaid is going to be a tremendous driving force in the healthcare system over the next couple of years. Many people don't know that Medicaid insures more people than Medicare for $100 billion less dollars. The pressure on the system for our underserved population is going to only get greater. And what I think we're going to see is, right now about 67% are in a capitated risk plan. I would expect that to get significantly higher, and that the member plans are really going to drive that innovation.
Jeff Myers, thank you so much for your time.
Thank you for having me.
And I'm Mabel Jong. Thanks for watching.